Constipation. Constipation is a condition characterized by infrequent bowel movements, difficulty passing stool, or the passage of hard, dry feces. It occurs when the colon absorbs too much water from food waste, making the stool hard and difficult to expel. Conditions causing constipation. Dogs, dietary factors, low fiber, dietary changes. Dehydration. Foreign body obstruction, intestinal parasites, neurological disorders, hypothyroidism, megacolon, pelvic or spinal injuries, prostate enlargement in intact males. Medications, opioids, antihistamines, antacids, stress and anxiety. Ruminants, cattle, sheep, goats. Dietary imbalances, insufficient fiber. Dehydration, intestinal obstructions, foreign body ingestion, abomasal disorders, paralytic ileus. Hypocalcemia, especially in dairy cattle. Pregnancy-related compression of intestines, vagal indigestion, intestinal parasites. Horses, dehydration, impaction, colic, sand accumulation in the colon. Enteroliths, intestinal stones. Insufficient exercise, poor dental health affecting chewing, ileal impaction, pelvic flexure impaction, parasitic infections, diet changes, especially low-fiber diets, pelvic fractures. Laxatives, anti-constipative agents. Definition: laxatives are substances that promote bowel movements by increasing the motility of the intestines, softening the stool, or lubricating the intestinal tract. Categories and mechanisms of action. 1. Bulk-forming laxatives mechanism. Absorb water and expand in the intestine, increasing fecal mass and stimulating peristalsis. Examples: psyllium, methylcellulose, bran. 2. Osmotic laxatives mechanism. Draw water into the intestinal lumen, softening stool and increasing bowel pressure. Examples: magnesium salts, sodium phosphate, polyethylene glycol, lactulose. 3. Laxatives mechanism. Directly stimulate intestinal smooth muscle contraction and increase intestinal secretions. Examples: bisacodyl, senna, castor oil. 4. Lubricant laxatives mechanism. Coat the intestinal mucosa and fecal mass with a waterproof film, easing passage. Examples: mineral oil, liquid paraffin. Stool softeners, emollient laxatives. Mechanism. Reduce surface tension of stool, allowing water to penetrate. Examples: docusate sodium, docusate calcium. 6. Prokinetics mechanism. Enhance gastrointestinal motility. Examples: cisapride, metoclopramide, erythromycin. Clinical uses. 1. Treatment of constipation, acute constipation relief, management of chronic constipation, prevention of straining in patients with cardiovascular disease. 2. Preparation for diagnostic procedures, cleansing the bowel before colonoscopy or radiographic studies. 3. Management of specific conditions, impaction, colic in horses, megacolon in small animals, foreign body ingestion, to help eliminate small objects. 4. Toxin removal, accelerating elimination of ingested toxins. Precautions. 1. General precautions: avoid use in intestinal obstruction. Use with caution in dehydrated animals may interfere with absorption of other medications. Long-term use may lead to dependence or electrolyte imbalances. 2. Species-specific precautions. Dogs. Avoid stimulant laxatives in dogs with megacolon, ruminants. Use with caution to avoid disrupting rumen microflora. Horses. Mineral oil can cause aspiration pneumonia if administered incorrectly. 3. Contraindications: acute abdominal pain of unknown origin, suspected intestinal perforation, recent bowel surgery, severe inflammatory bowel disease. 4. Administration considerations: ensure adequate hydration during laxative therapy. Monitor for electrolyte imbalances with prolonged use. Adjust dosage based on species, age, and condition.